So thank you very much. So how do we know that a patient has developed these conditions? What are the signs as well as the symptoms? So number one, they will have a painful swollen joint due to the inflammation of the joint tissue. Remember, even the joint are affected. They will also have chest pain due to the carditis. They will also develop a fatigue. Others will also have a shortness of breath. Others will also have a fainty, pinky, or red lash. And then others will have a jerky body movement, which are the chorea. And then others will also have fever due to the inflammatory process. Now, how can we know that what are some of the investigation or the diagnostic measure that we can do to these patients? So number one, there is no lab test that can confirm that this is rheumatic fever. Remember at first we said this condition is rare. So doctors base a diagnosis of rheumatic fever on the presence of certain criteria. So the most common major criteria are: number one, if a patient has joint pain, swallowing that moves from joint to joint, if the heart has been inflamed. The diagnosis of rheumatic fever requires not only the presence of key signs and symptoms, but also the evidence of a recent streptococcal infection. So it's not easy to diagnose this type of infection. So a blood sample may be taken to test for the presence of antibodies to streptococcal bacteria. However, it's possible by then the throat culture test for strep will be negative. In this case, the only suggestion of streptococcal may be the patient telling the doctor about the recent symptoms. So this may help. Again, diagnostic of rheumatic fever will likely to involve a physical examination and questioning about your symptoms. So the physical examination include checking the joints for pain and inflammation, examining the skin and lashes for lumps, listening to the heart for the abdominal rhythmic or numerals, even doing a neurological examination to check the abnormal movement.